So we have Dr Zunaid Alli from Vivacy International, and we're going to be talking about Stylage HydroMax today.
Ooh.
So I'm really intrigued, and it's so lovely to have you here
Cool.
on
Thank
Beauty
you very much
Investigate.
for the invitation.
Not at all. Thank you for joining us. It's lovely to meet you. So I'm intrigued. We both are. Tell us all about it.
So Stylage HydroMax is essentially a treatment that we use for boosting skin quality or for improving skin quality. So it contains hyaluronic acid. It is made by the company that essentially makes fillers, but it's not a filler. It is a treatment that has hyaluronic acid in it, and it's got something in it, a humectant or moisturizer called sorbitol, that is added to the product, and it's injected into a very specific layer of the skin. And what it does there is it actually promotes hydration. It improves the skin quality, the skin tone and the texture without giving the effect that a filler would. So you don't get any of the structural changes, you don't get any changes in the proportions, you don't get any volumization. All it does is it improves the quality of the skin.
And there's not very much around like that. I mean, normally if you have some sort of filler, I mean, how do you give this treatment?
Right, so the treatment is given either by needle or by a careful placement of a dermal cannula.
Right.
Now, most practitioners would essentially, if we're treating areas of the face where the skin is lax, it's a little bit dry, you're starting to see a lot of surface markings, texture is a problem or an issue, you find that a lot of doctors would essentially use a lesser invasive approach using a dermal cannula, which is basically just a long, blunt needle that goes into a layer of the skin where there aren't a lot of free nerve endings, and you leave the product there in kind of what we call linear threads, so they're kind of lines. So you leave the product underneath the skin. And when you've finished, right and left, you then massage the product in, and that it sits in a very specific layer of the dermis. So not the layer of skin that we can see, the layer just underneath it. And this is where the hyaluronic acid and the sorbitol gets to work, and it starts drawing moisture into the tissues, and it also stimulates fibroblasts. Now, fibroblasts are the cells that are responsible for the production of collagen, and one of the building blocks of collagen is hyaluronic acid. So what you're doing is you're essentially injecting a substance into the body, which is not an acid at all, it's a sugar, it's a complex sugar, and you're injecting it into the body, which the body makes anyway, and it's non-animal, it's tested, it's got a really wonderfully superb safety record that has been published, and what you find is it will then start to get to work. So it really doesn't change the structure of the face like a filler does.
And can you have it anywhere?
You can have it anywhere.
Can you have it in your boobs?
Not quite. Almost everywhere.
Oh, well, I mean, what about boys?
So, men, absolutely.
Really?
Yeah, absolutely. It's got quite a few treatment indications or areas where you can use it. Now, certainly the mid and lower face are the areas where we use it the most. You can use it for lines around the mouth. You can use it in the neck. It's exceptionally lovely to treat. We call them venous lines. So they're the horizontal necklines that you can see that I have. So you can treat those with Hydramax. You can certainly treat the décolleté. And this is a problem area for a lot of women. We find that when patients have treatments with us, cosmetic injectables, they often neglect certain areas, and that is the neck, the décolleté, and the back of the hands. You can certainly use it in the back of the hands as well.
Gosh, yes. What about under?
You can use it in. You can use
yeah,
it
it's here
in the
because
triceps
this
area.
is one of the things, isn't it? I mean, you know, what on earth is that? Where did that come from?
So that is loss of elasticity, loss of collagen, a little bit of muscle atrophy as we age. So as much as we try to kind of bulk up the muscle, it's the skin quality again that is actually needing to be treated or needing to be looked at. So I've certainly done treatments there. You can do it on the top of the knees as well.
Wow.
I have a patient who's a very avid tennis player, And she, she has her treatments done, here and there. She's quite conservative in her approach. And the thing that actually bothers her the most
Her
is when
knees.
it's tennis season. Yeah, it's just the lines that sit above the knees. So it can certainly be used there. So any area of the body where you really want to improve skin quality, you can use Stylage HydroMax.
Wow. So, I mean, people that are losing weight very quickly with these, like Monjaro or Ozempic or
Wegovy,
whatever.
yeah.
So this can help with that.
Yes, absolutely. Now, there are two components to weight loss, and we have, within that group, we have the rapid weight losers, and then we have the patients who, certainly some of my patients, take it low and slow. So they're on low doses and they go for many, many months and they're losing weight incrementally. Those patients don't tend to lose valuable facial fat as quickly as the patients who lose it more rapidly. So there are two components that I mentioned, and one is actually replacing the volume. And this is where those kinds of treatments, unfortunately, you're losing weight, you're feeling better, your blood tests are looking better, your cholesterol's down, your joints are not aching as much, but essentially the face takes a bit of a hit. So does some of the key structures of the body. And this is where we need to kind of look at putting it back. So for example, I won't treat a patient if they've lost a lot of weight until they are within about 5 to 10% of their ideal body weight. Because as you lose weight, metabolism speeds up. You can't really pinpoint where you want the tissues to be lost, where you want the shrinkage to happen, let's put it that way. So essentially, it will happen in the deeper fat compartments of the face. And that's the structure. Those are the structures that sit right on top of bone. So this is when you see that they tend to have a little bit of what we call a split cheek. They lose the volume here. And along with that, the second part is the skin quality then starts to be affected. And you see them having these deep cheek lines that they've probably never had before. And when you're putting the volume back, you've got to do it in the same way, low and slow. So you start from the deepest, and there you have to use a traditional filler. And then for your skin quality improvement, you use a product like Stylage HydroMax. So it's kind of almost like a dual layer kind of a technique. And once you replace the volume, the quality of these fillers are really
But
good.
on the décolletage, how do you work it? Sorry, darling.
Right. So
Yeah, I was going to say the same thing.
So the décolleté is, it's quite, the anatomy of the area is you don't have a lot of hypodermis or hypodermal fat. So what I mean is you've got the skin that we can see, epidermis, right? The little bit of a layer that sits below it is the dermis, and the layer that sits below that, just above the bone, is what we call the hypodermis or the fatty layer. And you don't really have a thick layer on the chest. So your technique of placing HydroMax in that area, some practitioners will use a needle, some will use a cannula with anesthesia, of course. And you very, very carefully, almost in a fan-like distribution, kind of inject the product. And what that does is it improves the skin elasticity, it gives hydration to the area, and it helps to smooth out the lines. So when a patient sits in the chair, we usually sit them back, and when we mark out where to inject HydroMax in the décolleté, I get the patient to do this.
Yeah, I know exactly, because
Yeah.
that's
a little sassy pose.
that's
you
where
can see.
you can
Yes,
see,
exactly.
because I'm coming in to see you,
Exactly.
and that won't be there next time.
No.
And that's exactly where you would place the product. So it's very careful placement. Remember, you've got a lot of superficial sensory nerves all across the chest. So you've got to take a little bit of an extra step to make sure that there's sufficient anesthesia and that it's comfortable
Do you
for the
have to? I
patient.
mean, I don't usually have any treatment that I have. I very rarely have anything local anaesthetic, and they always say, "Oh, you're gonna."
Yeah.
I very rarely have it.
It's practitioner dependent. I'm a little extra, but I mean, I suppose it's because we have treatments ourselves, and that initial bit of it going through the skin that you can feel. If you can make that a bit more comfortable, then by all means. One of the things that you also have to be aware of on the décolleté is you've got a nice network of superficial veins that sit right across the chest. So you've got to be quite careful in your placement of the product. You don't want your needle to go through any of them, because then your patient will essentially have a bruise. So we see lots of patients who come perhaps before the summer season, perhaps before a wedding or an event, wanting to improve the quality of those lines. And you can do it anywhere. So the décolleté that we mentioned, the anatomical borders, are from your collarbone all the way to where the breast buds start. So it's this kind of V-shaped area around there, and that is something that can be treated with HydroMax.
And does it last a long time? I mean, what about the downtime, and then how long does it actually last?
So the downtime is when you are performing the treatment with a needle, you risking kind of going through blood vessels, so you can cause a little bit of bleeding, and with bleeding comes bruising. With a cannula, you're a little bit more precise, so you get to control a little bit of the bleeding and, of course, the bruising. With HydroMax, we generally tell, and certainly the way we teach it to other practitioners, is that you do a course of 2 treatments, and you do that generally 3 to 4 weeks apart, and that will last you between about 6 to 9 months.
Excellent.
So it does have really good longevity.
That really is good.
And your hands, the treatment on your hands.
Right. So the treatment on the
I'm
hands
interested in that.
it's the dorsum. So it's this part of the hand here.
Yeah. So
And
I mean, these horrible veins that I've never had before.
So very similar to the neck.
Yeah.
You don't have, remember, the hypodermis, which is that nice cushion of fat that we have in the face.
Yeah.
We don't have it in the back of the hands. We don't have it in the neck. We don't have it in the décolleté. So this is where you'll see vessels and structures more prominently. So what you do is you place the HydroMax with a dermal cannula, and each practitioner will approach it differently. I like a single entry point just at the wrist, and with the same dermal cannula, place the product in here, massage it into place, and then essentially leave it there. And you do a second treatment about 3 weeks apart, and that will last you also about 6 to 9 months.
And is the result instant?
The results are instant, but your best result with hyaluronic acid skin boosters are seen at roughly between about 2 to 3 weeks. And we find that, especially with younger patients where they don't have that much collagen loss, we find that they will generally see a better result or more noticeable result after the second session. But with our patients who have got a little bit of skin laxity, a little bit of skin quality issues, those patients generally see an improvement after the first session.
And tell me something, it's something I've been thinking about. Why can't you do something for the wrinkles on your fingers?
But you can. There's a different product that we use. It's also part of the Stylage range, and you inject it just underneath the layer of skin on the fingers. Now, fingers, that can be a little bit painful. So we have a technique that we use in clinic with a little bit of numbing cream. Put your hands in gloves, give you a cup of tea, and in 20 minutes we're ready to go. And that helps to improve the quality kind of in between.
Oh, that would be amazing. I would love that, because I always think, I've always had nice hands, but I always think, gosh, what's happened to my fingers?
Nice
and feet. Nice hand, nice feet. It's just the
Yeah.
middle bit that's not very good.
That's why we
Exactly.
I'd love to get my fingers done.
Absolutely.
Yeah.
Can be done.
Because can that help with arthritis as well? I know that sounds a ridiculous thing to say.
I think you've just slightly opened Pandora's box here.
Really?
So there are hyaluronic acid products that can be injected intra-articularly. And Vivacy, as a company, they make these products. They're not for use in the UK, they're for use on the continent, and they are actually injected into joint spaces, kind of the hips, the knees, the ankles, because the loss of hyaluronic acid happens in all structures that contain collagen, and that includes articular structures. So, you've got your steroid injections, you've got your PRP injections. Your steroid injections, you can only have a certain number of them before you would need a replacement. Your PRP injections are a regenerative treatment. It's autologous, which means You derive the platelet-rich plasma from your own blood. You can inject that into joints, and often they mix hyaluronic acid with it. Why? To just aid in the lubrication of joints. So you've got hyaluronic acid from the top of your head to the bottom of your feet and everything in between. And this is something that we lose as we age. So the rate at which we lose collagen starts to decline from about 25 to 27, and it accelerates in women during the menopause. Men have a slightly more kind of gradual collagen decline, but it certainly happens to men as well.
So Vivacy is the company.
Yes.
And we can see you in Wimbledon at your
Yes,
clinic.
yes.
And what's the name of the clinic?
It's called Edition Clinic.
Edition
Clinic.
Edition Clinic. And
Only one stop from me.
oh, it is one stop.
Surbiton.
Yes.
I'll be on there. I'll be on there. I'll be
Yes,
there. I'll be there tomorrow
absolutely.
morning.
Yes, definitely. And also, that it is actually, Vivacy is all over the country, isn't it?
Yes, they are. So what they've done with Hydramax, so Hydramax is a product that's been in the portfolio for quite a number of years. And because the industry and the need is more towards skin quality improvement rather than using too much of filler to overfill, you know, the whole pillar face that people seem to have moved away from, thank goodness. And now it's all about skin quality. So they have actually developed a clinic finder website. So all of the clinics that you see on that website have been taught and they've been obviously vetted. So they've done official training with either myself or another member of our very esteemed faculty throughout the country. So you'll be able to find your nearest clinic that offers a Hydramax treatment.
Right.
This way, we make sure that we, as trainers of the product and users of the product, we standardize it and we make it safe so that everyone is on board with how to use it and how to make sure that they get the maximum benefit out of it for their patients.
Of course, that's really important. And how wonderful that you're doing this.
Thank
So
you.
lovely to meet you.
Lovely to meet you too, and thank you so
Thank you
much
for
the
coming to
invitation.
see
Thank
us.
you so much.
And we will be coming to see you.
Oh, yes.
Try and stop us.
You're very welcome.
Thank
Thank you.
Cool.